My name is Jana Svoboda, and I'm a licensed clinical social worker, and I'm here working for Samaritan on a grant from the IHN. And the IHN, as you know, has an aim to help make healthcare more affordable, more efficient, and more accessible. In the history of medicine, especially in the last, it seems to me, 20, 30 years, there's been a real split about what is medicine covering. And so we get this idea that there is medical health and then there's mental health. And part of my hope was to reduce that schism, to say that, look, your body and your brain are born in the same container. Your heart, your soul, your brain, your lungs, your feet, your emotions, all contained in this one bag we call our body. And if you try to pretend that what is happening in one part of that set is not affecting the rest of the set, you get in a lot of trouble. So what I found is that about 70 to 80% of the time people go to the medical doctor, what they're really talking about is something that's not working well in their life and it's showing up in their body. And some people think that sounds like voodoo, but this is just science. When you are stressed out, when you're under a lot of pressure, your body is secreting these hormones that are designed to get it out of troublesome situations. So your body gets flooded with adrenaline, and you're supposed to use that adrenaline to fight and flight. Your pupils dilate, and you start taking in all the information, and you start sweating, and all these have really good purposes if you're getting eaten by a bear. And they don't work out so well when the major problems that you're solving are things like paperwork, deadlines, and trying to figure out Epic, or trying to figure out how to sign up for insurance. You know, all these kind of modern daily problems that we have where you can't beat anybody up and you can't run away. So what I try to do is teach patients in the doctor's office how these stresses are affecting their body and then teach them ways to decrease the stresses. I try to demystify the idea that when the doctor says to you, this is stress related, he is not or she is not saying to you, you made this up, or it doesn't matter, or it's not really hurting, or something's not wrong with your body. But what they're saying is what's wrong with your body is not something that we can cure by giving you a pill. Or it's not something we can say, oh, your disease is X, and it was caused by this germ. Because a lot of our dis-ease is caused by the germ of life. It's just the regular kind of problems that we run into every day. And we don't use our bodies during the day to work off all those chemicals like we would have in the old days. So even when we can't fight or flight, we still would have worked the chemicals off just in daily life. Now we sit around at our desks and work on Epic or whatever it is we do, and our bodies don't move and essentially think we're trapped. So the circulating stuff results in inflammation, which results in inflammatory disease, like heart disease, like asthma, like diabetes, which is an autoimmune disease. We've seen a big surge in these kind of things. So sometimes the doctor will say, you know, you should go get counseling. And guess what? People don't do it. The main reason people don't go is because there's a stigma about mental health. The idea that mental health problems are a result of a character defect, a lack of discipline, some kind of moral problem, as opposed to just like our physical health, some of us have stronger components in some parts of our bodies and some parts of our coping skills and less than others. So I like to be right there in the office when somebody's talking to their doctor and saying things like, you know, I don't know what's wrong with my hormones, but I want to kill my husband. Or they say, you know, I'm so stressed out from my job that I can't sleep anymore at night. And the doctor says, well, here's why I don't want to give you a pill for that, a sleeping pill, because it may help tonight, but we can't give it to you forever, and then what do? And then the person goes, great, I just don't sleep. So instead of that being the end of the session, I come in and I say, let's talk about what we can do to help you with your sleep. Let's talk about what's not working in your life, what we can change, what we can do differently. I work on how are you going to have a sense of purpose in your life, to feel like there's some reason you're here and that you're enduring this suffering. I work on trying to help them increase their natural resources. Having mental health services available in the doc's office where people show up anyway once a year is cost effective, because if people can get their help there through me in a session or two, that's a lot cheaper than a visit to an ED. It's a lot cheaper than a hospital visit because they haven't been able to manage a chronic health condition. It is convenient, it's low stigma and low barrier. People are much more likely to come back to somebody they've actually met than to go meet somebody they've never seen before and tell them their life story. So I'm encouraging Samaritan to look at social workers more as a clinical resource for the clinics, a low-cost one. People returning back to school, people being able to form intimate relationships, people finding meaning and joy, people adding to volunteer services. I've had people get off opiates after 7 and 8 years, get off disability and go back to work. You can't measure that stuff with a PHQ-9. I mean, I can show you that it got better, but that doesn't really tell the whole story. So I find this work incredibly fulfilling. There's nothing better than the honor of sitting down and hearing somebody else's story and then looking at what strengths are already in that story and helping them use those to have a healthier and happier life. And I thank the IHN for the opportunity to do this for 1.5 years. It's been a lot of fun.